If simple activities are leaving you out of breath, you may want to reconsider the reason why. By the time 80% of people with chronic obstructive pulmonary disease, or COPD, receive their first diagnosis, they already have moderate to severe symptoms and have lost significant lung capacity. Candyce Norris, COPD patient, and Dr. David Mannino, U.S. respiratory expert at GSK, join us this morning with some important information. Good morning to you both.
Good morning, Chris.
Good morning, Chris.
First question for Doctor. Why don't patients open up more about their symptoms to their doctors?
Well, Chris, I think there are multiple reasons for this. Sometimes they may not recognize that their symptoms are in fact related to COPD. While it might be obvious if they're wheezing or coughing, sometimes the symptoms are just fatigue, and often they may attribute these symptoms to simply getting older. Then in addition, some patients may be embarrassed by this, and particularly if a patient, for example, has smoked or is still smoking, and they may feel that they're embarrassed about this, that this is something they brought on themselves. And Candyce can actually talk a little bit about this, as this was her experience.
So Candyce, can you tell us about your experience there?
I can. I was diagnosed in 1996 originally, and I didn't take it seriously in the beginning, but eventually I had to. It is embarrassing to give out the symptoms to your doctor when you really feel that you brought it on yourself. But you need to get past that. You need to get past that the doctor's going to judge you, because that's not what they're there for. They're there to help you. Your family's the same. You need to open up to them. You need to look into all the websites that are available now, like COPDfoundation.org is a wonderful one for resources and information that'll help you on this path.
And doctor, how important is it to know the severity of COPD for determining management strategies?
Well, Chris, it's critically important for clinicians to have a good grasp on both the symptoms that the patients are having and also the exacerbations that they've had and other risk factors. And there are certain strategies that all patients should have. For example, and if they're smoking, they should have interventions to stop smoking, and they should get vaccinations for influenza and pneumonia. And patients should be on some type of exercise program, either a formal one known as pulmonary rehabilitation or an informal one, depending on their severity level. And then therapies have to be tailored to what the individual patient needs.
And for Candyce, how would you describe your symptoms to someone who doesn't realize that they may have COPD?
Your symptoms can be very, very frightening. When you're trying to breathe and it's like you're trying to inflate a brick, that's very difficult. It's frightening, and it is something that you need to have looked into. It's not a symptom you can ignore any longer. You need help from your doctor. You need help from your family. You really need to open up to everyone.
And doctor, where can folks go to get more information on COPD?
Yeah, as Candyce mentioned, the website of the COPD Foundation, which is copdfoundation.org, provides a wonderful resource for not only patients but also their caretakers and for physicians.
All right, I'd like to take a moment to thank both of you for being here this morning and sharing this very important information with our viewers.
Thank you, Chris.
Thanks, Chris.